Today's lifestyle is very stressful. Working in a city with our work commitments, family, friends, and hectic lifestyle. We are a walking time bomb. There is a silent killer lurking amongst us, and the only way to find out is to go for a medical checkup. Dr. Abdul Razak is here to share with us more.
It is one of the most critical disease. Some people, they say that it is a silent killer because it is without symptoms. But still there is some people complain of minimal symptoms like severe headache, visual disturbance, chest tightness, arrhythmia, palpitation. But this not for all patients. The most critical people who have asymptomatic people. Actually, is about 30% of the people in Malaysia have hypertension. Half of these patients is undiagnosed. And we are dealing now with just half of this percentage. And with this half of it also, it is controlled and on medication. And the other half, patient known case of hypertension, on medication but still uncontrolled. So still we are not reach our target for these patients also. We prefer to check regular blood pressure earlier, started from primary care unit when they are visit the primary care unit, or regular checkup when they are visit any clinic or any their family doctors. Maybe they become adult, age of 55 or 50, there will be regular checkup. But if there is a risk factor that the patient have a family history of hypertension, patient have hypercholesteremia, patient excessive alcohol, patient smoking, patient with a high cholesterol level, all these very high risk for the hypertension. We have a lot of mistake about this. Some people, they are going to get the medicine from over counter. Go to the pharmacy, tell I'm hypertensive, I want drug for the hypertension. Some other people going to the traditional medicine, herbs or something else. So all these, it is not a proper way to treat the hypertension. Hypertension need to proper drugs to control and proper follow-up, because we should be follow up the complication of hypertension to another organ. It is most critical disease to affect on the stroke, on heart failure, on the ischemic heart disease, on kidney problem, on eye. So it is one of the most killer disease. So we need to deal with this hypertension in a proper way. The proper way, it is proper diagnosis, proper management, and follow-up. Our aim, it is not it is hypertensive or not. Our aim is to protect the patient from the complication. It is a very big issue if the patient have any complication of this hypertension. Patient with hypertension, he got a stroke. So the stroke, that means all the life of this patient will be changed, because he will become crippled, cannot function well, cannot work, and all the time he use a lot of drugs. So it is a very costly for the government, for the family, and it is not effective person in his life. So all his life will be changed. But when we control blood pressure, still the patient can active, work, positive. We protect him from all complications for benefit of his family and his life. To do the best our life, we change our lifestyle with exercise, diet control, decrease obesity, stop from smoking, not take a lot of alcohol. This is the most important point, in addition to decrease stress. Decrease stress, sometimes it is very difficult for patients, but try to avoid it. So this is the most important point to be avoided to protect ourselves from hypertension.
Hypertension is a silent killer. Go for your regular health checkup and keep going to the same doctor so that he keeps track of your medical records. Live an active life, eat healthy, balanced diet, always de-stress yourself, and never try to self-medicate. Remember, stay healthy and stay happy.